Hello everyone, Dr. Dennis Harper here. We are on the first week of September right now. I'm talking to you from the woods in Idaho. So the data I'm going to give you, the information I'm going to give you is to this date, 2020, September 7th. What I'm going to tell you right now is my feeling of what COVID-19 is and is not. If I want to run a history and a patient asks me my opinion, which many have asked me this is what I tell them. One, it's a manufactured virus that probably came out of North Carolina, was transferred to China, and got loose from China. Why do I say that? In reference and a discussion about the virus, we know it has an S protein attached to it. An S protein does not normally occur. That protein makes it very attracted to cell walls and causes disruption in the system. And it causes a cascade effect in the body of the body's overreaction to it, different than a normal virus would react. That's why some people call it a more higher morbidity with this virus. Honestly, if we look at viruses overall, look at H1N1, we see that we had a much higher death rate with H1N1. We did not close the economy. We did not shut people down. We did not shut travel down. We tried to use some common sense. Common sense not being used here. And I think it's time for people to take responsibility for it. This is being driven by a standard of care, and the drug companies pushing a standard of care. Standard of care means that you come in, you get sick, you put on a ventilator, and the ventilator kills 85% of the people. But we've made it really acceptable for that because that's the standard of care. I'm always amazed at how we can kill people with the standard of care, and it's okay. I'm going to give you an example. There was a doctor about 2 years ago that was treating sepsis patients with high-dose vitamin C in the ER. He was getting 95 to 100% survival rate of people that would generally die from this problem. Sepsis is a general infection in the whole system. He gave them an IV of vitamin C, and they got better. He was trashed by the medical boards because of doing something that was not the standard of care. The standard of care would have killed 90% of those people, which was acceptable. You've got to understand, it's acceptable standard of care to die if you're doing what everybody else does. Not if it doesn't matter if it's right or wrong. It's acceptable standard of care. Right now, the people that died, let's go to New York and look at that and realize that we had a huge number of people sick in the hospital, put on ventilators, and killed. We know that we had changes in Medicare. If you had a COVID diagnosis, you got paid $13,000 more. If you got put on a ventilator, the hospital got $35,000 more. That was an acceptable standard of care, even though it wasn't helping people. So realize this is driving this whole system around. We know that younger people don't get sick. We know that 80% of the people get no symptoms from it. We know that people get better in 2 or 3 days. We know comorbidities come out, which means you have different diseases. We saw a study where it showed that only 6% actually died from COVID only on their diagnosis. This is all a paper shuffle. I'm going to tell you that because of the fact that if you have diabetes, high blood pressure, and a weak cardiovascular system, you go to the hospital with COVID, you have a higher percentage chance of dying, especially if they put you on a ventilator. So let's go back to the basics again down and talk about this. In Italy, they found that the people that died the most were ones that actually had had previous flu shots every year. What does that do? That fakes the immune system in thinking it doesn't have to respond because it's already built antiviral processes up in the T cells. So the body doesn't respond. And with the COVID, if it doesn't respond to it, it breaks the cells down, and then we get the pneumonias and the cytokine storms we keep talking about. So if you have a normal immune system, you don't get to the cytokine storm as easily. Does it happen? Yes, it does, but it's rare. So I want you to think about the fact I've watched two MDs on YouTube saying, oh, well, the numbers aren't really right, and, COVID pushed them over, and, it could be the cardiovascular pushed them over, could be the previous flu shots. We know right now that flu shot morbidity, in other words, death after having flu shots, generally in the last 5 to 7 years, has not lowered the morbidity or death rates of having the flu. You'll be told it does, but it does not. And now we want to have a vaccine for COVID, untested, rushed through, already done before this even broke out, you realize was being worked on. And now we're going to release a flu vaccine and give it to people with no safety record on it, and require it to travel, and require it to go anywhere, require it to go to work. This is wrong, people. The brakes have to be put on this thing quickly. Money's driving this. This is not politics. This is not Democrat, Republican. This is way beyond that and bigger than that. You're getting sideswiped by saying that it's for politics. It's bigger than that. It has to do with a lot bigger agenda. I will not go into that now, but there's a bigger agenda. I hate to be the black helicopter person, but there's some things going on here that don't make any sense medically, physically, and emotionally and psychologically. We're being played. We're being played big time. I'm going to tell you, it's time to stand up and say no to these things going on right now. And again, this is Dr. Dennis Harper, and have the most amazing day ever. I'll update you more as things go along. Thank you.